Good morning, everybody. We have a very interesting lineup today. Kelly Willem from IPart program and Brian Pfister from Conafay Group. Kelly will give a quick overview on early stage SBIR programs, and Brian will talk about how their organization can help with late stage companies with larger federal grants. Um, we are really glad that they agreed to give a quick overview of about these programs. And I'll ask Kelly and um, Kelly to start about IPART program.
Sure, great. Thank you. Good morning, everybody. I'm going to share my screen quickly here and pull up my presentation. Give me a second, and you all let me know when you can see that.
Yep.
We good? Okay.
Yep.
So here's my contact information. The Innovation Partnership is Pennsylvania's statewide small business innovation research, small business technology transfer assistance program. And we have over 18 partner organizations statewide with over 75 locations. I thought that was a pretty unique information. We had to gather that up for our grant proposal to the SBA that helps to fund the Innovation Partnership, along with Ben Franklin Technology Partners and our partner organization membership contributions. Our goal is really to help our early stage technology companies, innovators throughout Pennsylvania, and those spinning out technologies and innovations from universities and higher ed research institutions in the state to try to access and win successfully SBIR and STTR federal awards. We provide free high level pre proposal technical reviews to clients of our program. And we also, along with those pre proposal feedback, technical reviews, enable the awarding of phase zero proposal preparation grant funding, which can, for phase one, range anywhere from $2,000 to $3,000, or for phase two, up to $5,000. We also help support training and education opportunities for clients and our partner staff. So, really, just briefly, visually here, we have all these partner organizations that collaborate together. My colleagues and I, there are point contacts for folks at each of the partner organizations that help to vet the clients. This is beneficial because, in that way, the clients also receive information about the value add services of each individual partner organization and how, either currently or potentially in the future, they can access those assistance programs from the individual partner organizations as well. We provide the pre proposal review. And then, hopefully, again, with the assistance of all of our partner organizations, we can provide programs that assist with funding, staffing, other market analysis, access to capital outside of our partner organizations for the continued growth and support and commercialization of those innovations and those companies. So, just briefly here, I'm going to click through pretty quickly. These are our partner organizations that provide financial support as well as counseling support for SBIR and STTR clients. Um, we have a number of different organizations. Some are specific to the life sciences areas. Some participate in assisting life sciences companies, but aren't specific to life science areas. So you can see that we have folks involved with manufacturing like Pentab, and technology assistance services, and then our higher ed institutions as well, that have signed on to provide assistance. Recently, we engaged a partner of the Recycling Market Center, and I'm proud to announce that one of their clients actually did receive an EPA award that we assisted them with this summer. So that's really exciting because I don't think in at least the last decade we've had anybody successfully receive an award from EPA that used the Innovation Partnership. So that's pretty fun. Some things that we can assist with, counseling you if you're interested and you don't really know where to start. First, I would direct you to our website. Under federal funding resources and links, we have tons of information and hyperlinks out to the micro sites for each of the 11 federal agencies offering SBIR and STTR awards. But we've also put together a guide to agency registrations, which is important as you're looking to um, get prepared to submit an SBIR. This is one of the first things that you're going to do, coincidentally, with seeking out a topic for your innovation or technology and the agency under which that topic may be available. So we can assist you as well in querying previous awards to assist you with how to align appropriately with the agency and the topic area. Timing, our pre-proposal assistance process, hopefully based upon the guidance on our website and what our timing is for our pre-proposal assistance, really get you prepared in a timely fashion to submit and prepare a winning proposal. So, this is hyperlinked on the website, as I said, under federal funding resources and links. This is our guide to SBIR agency registrations. And there are hyperlinks to each of the registration pages, as well as the individual microsites again for those agencies. We always advise you, this is a guide. They do change things from time to time. So sometimes I may be a little behind the eight ball in getting this updated, but we always advise you to read carefully the actual solicitation itself to ensure that you are getting all the registrations that are necessary. So, what do we help you do in terms of our counseling? We can help you prepare to speak with a federal program manager, topic author, or TPOC. So, with 11 different agencies, each of the agencies tend to refer to their point contacts for the topics in a different manner, hence the federal PM, topic author, or TPOC. And we want to make sure that the agency is aware of your interest in submitting a proposal under the topic and solicitation. So we've developed a one-page company snapshot to help you communicate and hopefully have a phone call to talk a little bit with them about your planned innovation and alignment with that topic area to get some feedback from them and assure that you are indeed submitting under the correct topic area to the right, for NIH purposes, to the right institution or center for the NIH specifically. For NSF, they have their own submission process, which is preliminary, similar to our one page snapshot, which is called the project pitch. We've annotated that for you, and we can provide feedback in advance if you're submitting this project pitch to the NSF, hopefully to receive an invitation to submit a full proposal. So those two preliminary forms would be our starting point for helping you get engaged with the individual federal agencies. And we have that guidance and background. We've been doing this, the program started helping clients since 2003. So it's been a good amount of time. So here are the funding opportunities that are associated with our pre-proposal assistance program. That you complete this pre-proposal, and then we do individual feedback loops to get it in good shape, to vet it out to two subject matter experts in your technical field to provide you with critical feedback to improve your federal funding proposal. Based upon that critical feedback and the pre-proposal itself, we can award for the phase one either a micro voucher or a micro grant. And I note there on our slide that for first time SBIR and STTR applicants, we are typically awarding a micro voucher because we believe that working with a grant writing professional really does provide an added plus up for you, and having a better chance to receive that federal SBIR STTR award. The micro grant is cash directly to the client. We haven't awarded too many of those in the past 8 years because most of our clients are first time applicants or applicants who have previously submitted a proposal and have been unsuccessful on their own. So, of course, we want to encourage you and engage you to move from the phase one submission and being successful there to the phase two. Hence, our pre proposal called the Federal Marketing Assistance Proposal to assist phase two clients. This is a slightly different pre proposal. We emphasize more the commercialization section, and we provide a bit more freedom on the structure and content of the actual pre-proposal itself. Obviously, over the last year, there haven't been a lot of travel and training awards because folks haven't been traveling. But in the instance that you would find a paid training online for a webinar or a course that was directly related to your field of interest and your innovation, we could help defray up to $1,000 of that training for you. So here's a little bit about our accomplishments over the years. We've had pretty good success, and again, considering that most of our assistant clients are first time applicants to the program, so we think that this is pretty good. The average submission win rate across all 11 federal agencies offering these opportunities is between, I think it's between 14 and 21%. They've said now 17% may be an old statistic. So this is a snapshot of the Innovation Partnership website. I would encourage you strongly to go there and tool around and read about the information that's available. One thing that's of grand importance is what's on the solicitations link. We keep a table current, hopefully, of open federal agency solicitation funding dates and deadlines. The solicitations are hyperlinked over in this far left-hand column with the release date, open date, and the IPart deadline. You will notice that the IPart deadline is for the pre-proposal submission out to the technical reviewers. In order to get your pre-proposal really prepared to send out to the technical reviewers, I would, myself or my colleagues at the other organizations would need to start working with you 2 to 3 weeks prior to the IPart deadline. So if you call me for assistance on our deadline date, that's probably a no-go. Just as an FYI, but you can always check what those deadlines are under solicitations. As I noted previously, under IPart programs, you'll find federal funding resources and links. And this is where you will find the guide to agency registrations and a number of our other different resources that are located there. It's a long page, so you want to keep scrolling down to find out all that's available on that particular page. To learn more about the micro grant, micro voucher programs, and a refresher on the proposal support that I noted, you can go to right there at the top, proposal support under IPART programs, and it'll give you more information about those details. So again, here is my contact information, and I'm really hopeful that you have some questions a little bit later on. And I'd again encourage you to visit the website and check out all the information that's available there.
Thank you, Kelly.
Sure thing.
Brian?
Okay, very good. I will as well share my screen. So I'd like to obviously thank the organizers for the invitation. I'm very happy to be here. I'm with the Conafay Group. I'm a senior vice president with that government relations firm. We're located in DC. I think this is a great, sort of start in what we call non-dilutive funding. Most folks start with SBIR, STTR type programs. We take a little bit different strategy in what we do in the Conafay Group, whereby we often begin to engage companies who have had a capital raising event already, have organized, usually a senior leadership within their company, maybe have a board, i.e. have some stakeholders, and they're now looking for a longer runway. And we like to say a diverse funding strategy. And so oftentimes the federal government is looked at in that funding strategy for any company as part of it, but it's not the entirety of it. So I'm here to talk about building a long-term strategy, being proactive with the federal government rather than reactive, building upon maybe initial SBIR awards or other, and trying to step into larger federal awards through sort of directed engagement with the agencies. So why am I qualified to be here with you? I spun a company out of my graduate studies probably 20 years ago in the cellular therapeutic space, and funded that effort through SBIR awards. Was fortunate enough to have a large pharmaceutical company step in as a strategic partner and fund a number of those efforts after we established some good proof of concept data. And so I think, like many of you, sort of I had to traverse that, those efforts and those activities to bring in the revenues to undertake what we set out to do within that organization. From that, I was recruited to work for the federal government. And so, like many of my colleagues in the Conafay group, I myself have a background and a former role with the Department of Defense. We undertake a lot of different types of activities, from federal R&D funding strategies to more traditional government relations, to business consulting, to even coalition management. So our location in DC one might assume a government relations firm is our lobbyists. We do lobby, but I sit on the funding team, and so my role in the DoD and in planning and programming dollars has prepared me and my colleagues well to begin to understand how the federal government operates and help our clients step into more engagement or better engagement with the federal government. And so I'll talk a bit about why non-dilutive funding, the sources of funding, the tools to develop a funding strategy, and of course, finally, how to get help. So why consider non-dilutive funding? And beyond the obvious tangible money, there are many reasons to engage the government, to help retain equity in your organization, to get a young company off the ground, to sort of kick the tires on new ideas, to provide validation of that technology, to de-risk future investment. Some of those are more tangible, some of those are less tangible. One can never underestimate the influence, though, the federal award has on maybe your network of individuals you're engaging with, because it is in a sense, validation. So primary government funders, we focus on the biomedical area. So we like to say life sciences. Our strength is mostly in those biomedical areas that touch human health, rather than animal health, for example, or energy or something like that. And so the primary funders that we often engage, we heard about the NSF and NIH, so agencies within HHS, but also my former role was with the Department of Defense. And so some of the programs within the Department of Defense, that target the needs of the warfighter and of course their dependents and family members and the like. So we like to say these are mission-driven agencies. Oftentimes we split them into what's called investigator-initiated sort of agencies, like the NSF. So an investigator, with a good idea, or a company with a good idea, presents that idea to the agency for potential funding. Oftentimes, the NSF or NIH, a bulk of those programs are geared towards academic organizations and researchers. There are some programs, like the SBIR programs, that are geared towards corporate or industry type engagement. It's not universal. It's not the only. There are other programs outside of SBIR that do support industry. It's just sort of less common, I think, outside of SBIR programs to be successful, but it's not impossible. I think when you engage the agency, and particularly the NIH, you need to consider the NIH is composed of 27 institutes and centers. The appropriations that flow into the NIH, those institutes and centers, do not flow equally across them. That's an important consideration. Each one of these institutes and centers have a different mission associated with them. So when you look to compose a funding strategy, it's not just figuring out how to make a proposal. It's figuring out how to align that proposal, that good idea, against a mission within the agency that you're targeting. And that becomes more complex when the technology that you're wanting to get funded doesn't align squarely with an organ system or a disease. And so the NIH is a great example of an organization that's been established to have missions centered around organ systems and diseases. And so if you have a technology that crosses over several of these mission spaces, that can be challenging to navigate. And so what we like to say is you need to build a strategy for engagement, and the same technology can be positioned several different ways to address several different mission spaces. And it's imperative that you figure this out. So what are the hot topics within the NIH? At least today, obviously anything to do with COVID, vaccine development being up there, but there are things that are non-COVID that have significant programs, established programs or new programs, such as opioid addiction. The HEAL initiative is a great example. It isn't just about opioid sparing technologies, it's about providing care to those at risk, substance use, substance abuse, and the like. 21st Century Cures is a piece of legislative action that provided some programs and some additional appropriations that targeted the NIH, things like the Brain Initiative, the Cancer Moonshot, precision medicine. I think there was some regenerative medicine that came out of legislative efforts such as 21st Century Cures. It's a good idea to try to keep abreast of these, because you begin to understand where and why and how agencies are tasked to spend money, and aligning to those monies then becomes part of a strategy. Alzheimer's, I'd say cognitive impairment and other issues are a growing hot topic. Eliminating health disparities has been in the news a lot this year. Where can you predict topics moving forward? Increasingly, agencies, not just the NIH, but others, are becoming more and more concerned with the long-term health consequences of COVID and the current pandemic. So the COVID long haulers, you've probably heard of that. Vaccines outside of maybe even COVID to begin to address hesitancy or minority populations or special populations or at-risk populations are increasingly put in limelight today. Diagnostics, and of course, health disparities. Best practices for the NIH. We tend to like to develop specific aims first. This is the single most important part of any application, particularly to the NIH. If you don't have a good specific aims page, usually the rest of the application won't receive appropriate attention. This is the page that almost all reviewers within the NIH go to first. So do your homework. Which institute or center do you need to target? Talk to them. Don't guess. When I was in the DoD, 50% of what came across my desk was unfundable, not because it was bad science. It's because it didn't align to my mission space. So frame your ideas appropriately, develop your specific aims, then go reach out to the program managers. Oftentimes within the program announcements, they'll indicate who that is, network, and talk to them. Don't guess. So mission-driven agencies. We throw DoD into these, but also in the health preparedness and health security space, you may have heard organizations like SBIR and BARDA. So what do they fund? SBIR, BARDA are more advanced development. So products, once you make it past proof of concept, maybe have some initial engagement with the FDA, and begin to look at your clinical development strategy. It's when you begin to engage advanced developers within the federal government. The DoD has an advanced development component to it, but they also fund basic science. But again, these agencies are tasked to fund specific missions, specific directives to be different than the NIH or the NSF, so they don't fund the same thing. And so it's imperative to learn what those missions are. The DoD is pretty straightforward: support warfighter health and readiness. So it doesn't mean that your application to a specific disease is not going to impact warfighter health and readiness, but you need to think critically about how to position that to be relevant to active duty service members and their beneficiaries. So within BARDA, there are something called the broad agency announcement that's out there. If you're in the domestic health security, you're trying to address health threats like infectious disease or radiation exposure or chemical exposure, you should familiarize yourself with BARDA or agencies within the DoD like DTRA, Defense Threat Reduction Agency, or others. You reach out and ask questions. And so there are organizations like the Conafay group that are very familiar with these organizations. And so we're a resource for you. So again, don't guess, ask. So best practices for these organizations, they're rapidly evolving. COVID was not predicted per se, but the response was necessary. And so their priorities shift depending upon the shifting landscape. And it's imperative to keep abreast of that. I'm going to move to the DoD now. The DoD, again, is composed of a diversity of agencies underneath that DoD umbrella. It's important to consider that the DoD has a number of services, Army, Navy, Air Force, and the like, as well as some agencies. I can't think of a client that hasn't come to me and said, well, what about DARPA? DARPA is something that catches people's imagination like no other agency out there. They can fund some really interesting things, but again, DARPA isn't a funder of everything. And so you need to align to, again, the needs of the service members and position it appropriately. I think it's important to bring up there's a couple non-for-profit organizations that have been tasked by the federal government to exist outside the federal government, but yet use and spend federal funds. So the MTech, Medical Technologies Enterprise Consortia, is something that looks at DoD needs. And then the MCDC, the Medical CBRN Defense Consortia, it looks at threat agent needs of the warfighter. Both of these spend money outside of, let's say, the more traditional federal acquisition regulations. So they're more flexible and they're more open to conversation. So what are the threats or what are the needs? So endemic diseases, parasitic diseases, bacterial diseases, viral diseases, chemical and biological threats, both can be in terms of what's in the environment or what's been used as a weapon. So environmental hazards, heat and cold, altitude, systems hazards. So laser, thermal insults, stress, noise in the environment, operational stressors, sleep deprivation and the like. How do you get optimal performance in a complex operational environment with a lot of stressors? And of course, then injuries, hemorrhage, head trauma, blast injuries resulting from high impact forces, concussive forces and the like. So what are the hot topics in military medical R&D? A lot of interest today is along this concept of prolonged field care. How do we enable care in lower resource care settings, austere environments, maybe not on domestic soil, most likely not on domestic soil, for longer periods of time? So how do we enable high quality care in environments that don't look like a hospital? How do we apply artificial intelligence to aid in decision aids? Not just for combat applications, but for medical. Once an individual is injured or needing to perform optimally, decision support triage, sort of immune dysregulations, the consequences of trauma, metabolic dysregulation, TBI, polytrauma issues, so truncal injury, extremity injuries and the like, suicide prevention, pain management. Pain is a pervasive across many care settings. Military care settings are no different. They just have specific needs within those settings. Sexual assault, and of course, health disparities. I think it's important to realize that the DoD is also tasked with some what are called congressionally directed programs. And if you aren't aware of CDMRP, the Congressionally Directed Medical Research Programs, you should check this out because these are directed by Congress for the DoD to manage. But what you'll notice is many of these are disease, maybe not military specific programs. So autism, for example, Duchenne's muscular dystrophy, epilepsy, cancer programs. The DoD is one of the biggest funders of cancer outside of the NIH. So if you aren't aware of these programs, you should familiarize yourself with these. They come out once a year, unlike the NIH, which has multiple deadlines. There often are multiple mechanisms to encourage both proof of concept, preclinical work, clinical work, some of the less exciting toxicology studies, for example, are often hard to find funding for. These programs fund that, as well as sort of larger scale clinical trials. So they're an important bit of what the DoD has within its funding armament. So what's your best practices? Know your audience. Emphasize translation. So I think the DoD tends to be more industry friendly rather than investigator initiated or basic science type programs. So being an established entity oftentimes gives you a benefit in these programs. How you make an impact is important. The DoD realizes that not all innovation is the only market, that the only market is the defense or the government. Having a civilian market is important. That suggests sustainability, for example. And of course, develop strategic relations. Talk. You need to talk to people, get input. Again, don't guess in what you need to put in your proposal and what people want to fund. Take-home messages, different agencies have different cultures and missions. It's up to you to navigate them appropriately, talk to people. Don't be afraid to ask questions. Just position those questions appropriately to get a response. So you shouldn't go to the government saying, I'll do whatever you want, just write me a check. That usually is going to be unsuccessful. You need, again, position whatever it is you're interested in to align to their mission space, to be fundable, but most importantly, so they want to spend time on you. So at the Conafay Group, we help build strategy. So it isn't just responding to a program announcement, funding opportunity announcement, or other that has already been released. We think it's important to talk to the government before those announcements are released so that you can inform the government what they should fund, maybe even inform what gets requested in those proposals in the first place. And then, of course, navigate how you can best position your technology to be most fundable to those opportunities. So I'll leave you with my contact information and look forward to addressing questions.
Thank you, Brian. So we request if you have any questions, please type in the chat, and then we will relay this to Brian and Kelly for responses.
I think, Siri, you're going to maybe moderate any of these questions.
Yeah, as we come across. So Adam has a question regarding, can you provide some insights into the business model if you want to engage? I think this is to Brian Conafay.
Well, I think the business model is important to what Kelly presented as well. I mean, SBIR programs are really about your creation of a business that addresses a market that has some potential to it. And so, many of the non-SBIR programs don't necessarily require that, let's call it business model or business case, to be well developed. Some programs do. SBIR programs are one of them. I think that the different agencies have different ways they like to see it. So I guess I would encourage you to talk to folks like Kelly and that group to sort of understand the differences and maybe get some good examples. But there are programs, for example, that some of the translational programs within the DoD in particular that require, it maybe not called a business plan, but a translational plan. It's just another way of saying a business plan. They'll require things like, IP use. Do you have, clarity, use of that intellectual property, and of course, regulatory strategy. So in a regulated environment, whether it be pharmaceuticals, biotechnologies, medical devices, diagnostics, whatever it may be, oftentimes where we see people struggle is not understanding what is required to get approval of whatever your technology may be. And so oftentimes that's a space for consultants. If you don't have the resources to hire consultants, there are a lot of people to ask questions and a lot of resources online to figure that out. A lot of good guidances from the FDA. So you need a plausible pathway to approval is oftentimes very important. As well as supporting data to suggest if it's a clinical study, what does your statistical analysis look like? So I think business plan, business models, translational plan, whatever you want to call it, statistical support, regulatory strategy, increasingly become important. Review sections are looking at those more critically now than ever because it supports success, right? Support, de-risks technologies. Maybe Kelly has something to say about this as well.
So just before we go to Kelly, I guess, Brian, the question is more around how the companies can engage with you. Like, what's your business model?
Okay.
Yeah.
Sorry, I misunderstood that. Yeah. So the Conafay Group, we're consultants. Again, we tend to become more involved at later stage, after maybe a capital raising effort. We don't typically engage on a per proposal basis, meaning, oftentimes we'll get a question, hey, we want to apply to this SBIR program or this opportunity we see. We have a stable of grant writers we can point you to. Oftentimes, if you expect to simply outsource proposal writing, oftentimes that's an inferior product. But there are some really good resources out there, including grant writers or firms like the Conafay Group that can help position those, we call it massage those exercises in proposal development to be more receptive, maybe have a greater expectation of success. So we tend to work off retainers. The government doesn't work faster than a 12-month cycle. So our retainers tend to be 12 months in duration. And it is, and ideally, whatever it takes to be successful. So we help our clients not just develop or massage proposals, but develop that technical marketing material to engage the government in conversation. And we try to position you, the client, to own those relationships, to put you in front of the government, to talk knowledgeably about your technology, to align best to their mission, to be on topic, with the right keywords in place, to sort of say, so the best response you can get out of the government is, we highly encourage you to submit here. That's what you want the government to say, and that's that should be the outcome from a conversation, and that you get that conversation quickly. It doesn't get lost in their inboxes.
Yeah, Armin's question, like, can we see who got funded? Yes, definitely. You can go to these funding agencies' website, and all the previous awardees is available on their websites.
There's something more to say there. And so the NIH has a great resource, NIH Reporter. You should go look at what has been funded in your area, because you can look at those abstracts. You can look at publications that came out from those groups. You can know who was competitive for funding before you submit. The DoD has other resources. They don't feed into NIH Reporter. but CMRP program has resources of what was funded prior. That's a great way to figure out how to present technology to the government. So do your homework, do your due diligence, use those resources. They're great.
Also, I should note on if you go to sbir.gov, which is a resource that's available from the SBA regarding SBIR previous awards. You're able to filter on the left hand side by agency, by topic, by year, by phase, those sorts of things. And again, as Brian noted, it will provide you with an abstract of previously funded projects under SBIR and STTR, which again is important. Um, I always caution to typically not go back more than 5 years because priorities shift with the different agencies and their topic areas. Obviously, COVID is a prime example. So if you were looking for something related to that 3 years ago, you weren't going to find it, right? You may have found West Nile and other things like that that were more important for solutions or diagnostics or things like that. But it can give you a really good idea. Also, it's important to understand with SBI and STTR, specifically as you're getting started here, um, to understand the language of the agency. So it's writing a proposal. That's why we help with the pre-proposal to get you to refine and think about the language that you're using to explain your technology, your innovation, your solution, and your project. It's not a research article in a sophisticated scientific journal. And on the other hand, it's not a narrative children's story, right? So it's somewhere in the middle. It's really important to be able to read, at least with the abstracts, how these projects are being described, the ones that have been funded previously. And I do think that is extremely helpful to start to get your head around how to formulate how you're going to talk about and describe what it is you're doing, the potential for commercialization, your markets, and the like.
I would just say when you're looking at what was awarded priorly, use a diversity of keywords. So don't assume that your specific keyword you use to describe your technology is going to show every award that's relevant. So, be creative, enter many different keywords, combination of keywords, because these systems are imperfect. For navigating to the information that you want. So don't just be creative. I've seen too many people miss awards that were relevant simply because they described it or entered the wrong keyword or what have you.
Right, Brian. I like to say the expectation that the algorithm for searching behind these federal websites for the topics is not Google. So you need to kind of really refine or sometimes even make your terminology more general and less specifically scientific, if that helps at all as well. um, Specific language that is highly scientific probably is not going to elicit a whole bunch of results.
Can either of you comment on opportunities from USDA, grant opportunities from USDA?
In terms of so they have one solicitation a year, and it's relatively competitive because USDA is not one of the more highly funded SBIR programs. And you would think here in Pennsylvania we would have a lot of USDA awards, but again, something to keep in mind about the federal agencies: while these opportunities exist and they're looking for the best solutions, um, for the problem that they're describing and or the topic area, smaller agencies, there's some level of interest in providing award parity across the entire country as well. And you're not going to find that on the websites. So, and you're not going to find that in the solicitation. But if you take a look at the statistics of the awards by the smaller funding agencies, you'll find that they're not going to make 10 awards in Wyoming. USDA isn't going to do that. They're going to try to spread the wealth around a little bit and try to make awards throughout the country. So the competitive nature, you have to take into consideration the total dollar amount of the program, the number of solicitation opportunities a year, which is with USDA, it's one. Um, and then the maximum dollar amount and how competitive the program is looking. So my counseling would be, if you're looking at USDA, you'd also want to look at DoD possibly, and also NSF, because NSF really funds all forms of innovation. So we have different ways to counsel and approach and guide you as you're seeking out to communicate and look into different agencies, so that your time is best well spent in advance. Time is money, and we really don't want you trying to Google around aimlessly and digging into it's a wormhole, really, especially on these topic areas. And I think Brian can attest to that. And their guidance is similar to get you focused, get you to understand the mission and focus of the agencies, and refine your approach to what you're looking for. And obviously, his assistance is a more global approach and a strategic approach for your company, moving forward down the road, even beyond SBIR and STTR, right? So I'm at the starting point of your seeking for that federal funding to try to help you navigate what can be sometimes confusing and time consuming.
Yeah, we don't have a lot of experience with USDA. There are firms like us that do. Oftentimes we'll look to some of these other firms as strategic partners, but you know you got to remember human and animal health are becoming increasingly intertwined. And so we've touched the US FDA more in terms of zoonotic diseases. And so that presents a health threat to the domestic population. So if avian flu wipes out a poultry flock, that is a food risk. That is a stressor. And so there may be delivery technologies in the animal world, for example, to deliver a vaccine against avian flu to the poultry flock, where it's pellets, a chewable vaccine. That we've touched examples of like that. Where a technology has broad application. Why not a chewable vaccine for humans then? And so the strategy is then go where you have the most data. If it's in animal health, we maybe start with USDA, but then try to broaden the aperture of that application of that technology. Line up appropriate collaborators if you don't have them. Animal models are oftentimes a resource that becomes rare or less less institutionalized, and so you need collaborators to sort of oftentimes develop the data, but then to go to the agencies with that data or that proposal to generate that data for a diversity of applications. That's a strategy. So don't think too focused. Think outside the box. Sometimes same technology can get money from different agencies for different reasons.
Thank you, Brian. So we just want to update, like for the people joined in the middle, we are recording this session and we will upload this on our website with all the links that came up during the discussion. If wondering, like if you have any further questions.
So my email and I think Kelly's email are in our presentations, and so you reach out, ask questions. We're happy to help triage them. A lot of information is off the top of our heads. If we don't know it, hopefully we can point you in the right direction. So, I think our goal here is to help make people successful. I think we'd love to have additional clients, at the Conafay Group, but recognize not all companies are at the stage of development to really outsource some of this work, but doesn't mean that you shouldn't have access to information. And so, ask questions, build your network. There are people that know, about whatever question you have, and oftentimes willing to help you. So, that's I think been ever present throughout my my career, both within the government and now as a consultant. So.
Absolutely, and that's what I'm here for. So also, I would encourage you, if you do have questions, again, related to getting started in SBIR, STTR, um, contact me, reach out, let's schedule a time to talk. Typically, I can find an answer if I don't know it quicker than possibly you can. So I would encourage you to ask the questions that you have and keep track of your questions, and we'll dig into it. That's what I do on behalf of all of our clients and all of our partner organizations. I try to find the answers. If I don't know them, I'll look into it for you, and you don't have to spend your time doing that.
Yeah, and it often doesn't make sense to engage a consulting group like the Conafay group to put together an SBIR proposal. The monetary value, for the cost of hiring the consultant, the equation just isn't there. But as you look to step those initial, that initial success, SBIR awards or a, pilot project award out of your institution or something like that, into a larger award mechanism, that's oftentimes where we begin to become more significantly engaged with corporate entities. I should say that we help both industry as well as academic organizations. So oftentimes finding the right animal models or experts or clinical trial sites or something like that is a challenge. And so again, having a network to ask a network to help you find those collaborators oftentimes helps you make you more competitive. So again, it's all about networking.
Uh, thank you, Brian. Thank you, Kelly, for this excellent workshop on the funding opportunities. We will.
Yes.
Tony, do you have anything like need to wrap up?
No, but thank you, everybody, and thanks for the great questions. Hoping to hear from some of you in the near future.
Great. Thank you both. Greatly appreciated. Thanks everybody for attending as well.
Thank you.